So I want to thank all our speakers. We are going to take a break after this session, so we're going to finish up by 10:35 here, so about a 10-minute break before the second session. So we probably have about maybe 7 or 8 minutes for questions. So we'll take questions from the audience now, and we'll just ask, if you do ask a question, please do come up and use one of the microphones if possible. Oh, sorry. So that, do we've...
A number of the speakers, sorry, I'm John Pepperell from the Hearing Foundation of Canada. A number of the speakers have referred to stigma, and that's something that we've been trying to be doing some work on in Canada as well. I'm just wondering if you know, or if people can talk to the work that's being done on stigma affecting the use of hearing aids, or even the acknowledgement of hearing impairments here in the States.
Okay, that was the slide I took out in the interest of time. So we have my colleague Alison Chasteen is a social psychologist who studies stigma to aging. And of course, you know, is it stigma to aging? Is it stigma to hearing loss? Are these two different things? We are a bit unclear on that. So these same 300 people that we've had in this big study, we measured their stigma to aging. And in a nutshell, what we found, and we're writing this up now, is that people who, these are 50-year-olds and plus, some of them have a little bit of hearing loss, but if we just look at people that have no more than a mild hearing loss, we measure their hearing, we measure their cognition, they have self-report measures, they have the stigma measures. Stigma to age is related to actual performance on both memory and hearing, and it's mediated through self-report. And the contribution of stigma to age is independent of actual age. So now what we don't know, because it's not longitudinal, is we don't know, are the people who are performing poorly developing negative attitudes towards aging, or are the people who have negative attitudes towards aging declining faster? And we really need this answer to know how our interventions might need to address stigma to age and self-efficacy before we even begin to deal with hearing. So it is a hot topic.
So I'm not a researcher at all, but I do know that stigma is a construct of attitude in people. And so people who say they don't wear hearing aids because of how they'll be perceived are probably not aware of how they're being perceived because they don't hear. And I think that's a construct that we have to change in people's minds.
Take the next question.
Sure. Yes, I'm Alan Letts from Healthcare Technologies and Methods. And one of your slides mentioned airplane noise is one of the background noises. And I was thinking, for situations like evacuation of an airplane during an accident, or evacuation of a theater during a terrorist event, there's been so much concern about national security and emergency response. Is there research, or are there programs going on now to take into account people with hearing loss who are in those situations and cannot understand the emergency instructions?
Sure.
I don't know about airplanes specifically. I kind of doubt it, but I think, you know, some people, there is very clear concern about even people in their own homes hearing fire alarms, and how people with hearing loss are not going to have the fast response that they need in order to survive. So I think even in hospitals, noise in hospitals, we have in our national media recently had an example of a hospital on the prairies where people are supposed to be quiet and resting and getting better in hospitals, but hospitals are tremendously noisy. So they actually redesigned the hospital so that people could actually sleep and recover after their surgeries. We have standards for classroom design But why don't we have standards for healthcare environments? Why don't we have standards for long-term care facilities? And on and on and on. So we do need to move on accessibility vastly beyond just doing loops.
Again, just a non-scientific answer. There may very well be a safety issue in certain situations, but it seems to me the much more prevalent consequences are not hearing what your doctor tells you to do, not hearing what your spouse tells you to do. My son from college went out the door yesterday and waved goodbye, and my other son said, "Did you hear what he said?" I said, "No." He said, "I'm going down to the diner. Do you want to come with me?" So my son thought, I didn't hear it. I didn't know what he wanted. My son thought I didn't care enough to go to the diner with him. I think it's the insidious, subtle consequences in everyday situations where we really need to focus the most attention, because I think that affects everybody. If I'm in an airplane and I have to evacuate and I don't hear it, I'm going to pull the person next to me and they're going to take me out. So I think it is insidious, it affects every situation, but to me the most fundamental situation are the inability to communicate and therefore the impact in terms of a contributing active member of society. Personal view.
Let me just jump in again and say there is literature that shows that there are more adverse events in healthcare for people with communication disorders, which would include hearing loss. And I've been trying to talk one of the MBAs who does hospital management at the geriatric hospital where I do some research, because they're looking at patient flow. You know, how long does it take to get a patient, you know, through the admissions process and on and through different stages in a hospital event. And I would love that to be broken down according to people with hearing loss or not. And I bet you, there's a lot of inefficiencies in the processes that go on in the hospital because you have to repeat things, because people don't understand, et cetera.
So I think we have.
Can I address this?
Sure.
Okay. I personally have been in a number of emergency situations, as whoever it was just said, and where I didn't hear. I slept through a fire in a hotel because I didn't hear the fire alarm. My husband had surgery, and the surgeon came out to tell me the results. And first of all, I was so anxious that my hearing was worse, but also it was in a hospital with a big atrium. I didn't hear a word he said, even though I asked him to repeat it about 5 times. The EMTs come to my mother, the doors open, the fire, you know, the alarms are still going, the trucks are humming. They're saying, you know, well, I don't know what they're saying. You know, they're asking me about my mother's condition. I can't explain it. So I think these emergency situations are really, really important. And there is, by the way, a fire system that you can hook up with your own home fire alarm that's a light operated system. I've never been able to make it work, but it does exist. And so if that technology could be simplified, you know, that would make a huge difference, at least at home or if they were installed in all hotel rooms. Fire is a really, really important issue, I think. So I agree with that speaker that we need to think about these.
So we're going to take one more question, then we're going to break just for a few minutes before the next session. So I think it was on this side.
Good morning, this side. Mr. Furman, you mentioned the invisible nature of hearing loss. So I'm curious from the panel's perspective, from a public health standpoint, how or where does that start to become visible for the patient? Besides the wife, more from a public health standpoint, what can we do from a society standpoint, public health standpoint, to make it start to become visible?
Well, you know, it's a good question. If people have a vision loss, you put the glasses on and then it's obvious to everybody what was happening. We don't have the equivalent of anything that's simple and elegant in this situation.
I think that, you know, part of the problem is the fact that hearing loss is supposed to be so much correlated to aging that it's supposed to be normal. And so even in primary care, even in a situation where you could capture hearing loss in the early stage and try to correct it whenever possible, it doesn't occur because it's just one of the many, many things of aging. And, you know, I remember talking to a group of centenarians. As you know, the prevalence of hearing loss in centenarians is enormous. 60% of the centenarians have significant hearing loss because of the effect of aging. And you know, if you talk to them, I interviewed them a few years ago, hearing loss for them is the most important concern. The first thing they're going to tell you is that they're afraid that something's going to happen to them and they're not going to be able to react because they cannot hear. They're happy about everything else, but their constant complaint is that. So I think that sensitizing the society that this is an important problem and including this as one of the issues that is screened in primary care will be extremely important.
So we're going to go ahead and finish up there. I want to thank all of our speakers from our first session. And we'll come back here at 10:45.